Welcome to the Newly Diagnosed presentation. Our members include Shira Rosenfeld, Parkinson's Foundation USA, Francesco de Rezenzi, European Parkinson Disease Association, Catherine Crawford, Parkinson's UK, Genko Oyama, Japan, Holly Kamoff, Parkinson's Resources, Jody Brown, Parkinson Association of the Rockies, and Jean Blake, Parkinson Society, British Columbia. This working group was identified as a priority by the World Parkinson Leadership Forum because worldwide there are 10 million people living with Parkinson's disease. An information gap exists for people just diagnosed with PD and uncertainty about where they can turn to for support and resources. Many people often experience symptoms years before an official diagnosis. If they can be connected with earlier and more frequently, this information and support has been shown to improve quality of life and lead to better health outcomes. It is important for individuals to have trusted sources to provide the needed information to make sense of the disease and what it means for them. Through an online survey, WPC asked committee members to share information about their organization's activities related to people with PD who are newly or just diagnosed. We found a variety of services being provided by various organizations. However, although there are many similarities, there is no uniform or standard set of materials or resources. There was, however, agreement as to the objectives for connecting with people who are newly diagnosed, namely to educate, support, motivate for self-efficacy, and provide hope. In the survey, organizations were asked how they were reaching the underserved. Those that provided outreach did it through grassroots initiatives, such as through churches, support groups, community groups, providing public forums in communities, and even providing free transportation to attend these activities. Of the organizations who responded, 41% indicated they dedicated resources to a newly diagnosed program. They offered telephone or online counseling and self-efficacy programs. Organizations also fostered collaboration with health professionals, providing traveling programs and scholarships to educate health professionals. Their collaboration with neurologists included tools such as prescription pads and a system for referrals to the organization. Many resources were also available online. The Just Diagnosed Committee decided to obtain a sampling of the resources available online. Some of our members had well-developed resources and packages focusing on the newly diagnosed. For those with access to the internet, there are many resources at your fingertips. Some examples can be found at Parkinson's UK, Parkinson's Foundation USA, and Parkinson Society, British Columbia. However, if you have no computer, no access to the internet, or have few or little technical skills, these resources are beyond your reach. The committee decided that this may be one of the challenges needing to be addressed. We wanted to get more information from some of the organizations that might be taking on this challenge or have other issues preventing people from accessing resources. We decided we needed at least a sampling of information from countries and organizations that did not participate in the WPC survey and who might have different issues, particularly regarding underserved populations. We interviewed people from organizations of different sizes, who are working in different economic or different cultural contexts, and with variable available resources. When the interviews were shared in the committee, there were themes that carried through from country to country and organization to organization. Shame and stigma was a theme throughout, and these issues often keep people from engaging with the very organizations that can help them. Stigma and relationship in families can cross over different ethnicities. There are differences even in a country like Italy in different parts of the country. These cultural difficulties can be similar between various countries, even like Italy and Malaysia. Stigma can result in denial and not accepting the condition, as the person does not want their family or even their care partner to know. This results in a further delay in getting resources. Reaching people with young onset was described as a real challenge, especially because of the additional issues they are dealing with. Cultural issues, such as a multiracial country with many languages will have, directly influences how people interact or not with the medical community. Lack of education and/or awareness reinforces misconceptions instead of the things that can help you to live well with PD. Those with no or little access to internet have even more difficulty, as it is a challenge to connect people with resources.
I represent the European Parkinson's Disease Association, which has member organizations in more than 25 European countries. Europe is far from being a homogeneous context from what concerns Parkinson's community. In fact, every country is different, with different healthcare systems, different social and economic situations, and national and local Parkinson organizations are also all different from each other in size and in the way they operate. I interviewed EPDA member organizations from the Faroe Islands, from Italy, from Malta, and from Slovenia. Without claiming this to be an over-exhaustive sample, there is enough variety, though, in terms of size, of culture and population among these countries to allow us to highlight significant differences or similarities. Bearing this in mind, there are two main blocks of issues that affect the extent to which Parkinson organizations can engage the newly diagnosed. From the organization side, a general lack of resources impacts the development of resources and activities specifically for newly diagnosed people. Some national organizations are relatively small and the reach is somewhat limited, hence they do not differentiate their audiences. This is the case for the Parkinson's organization in Malta, for example. And also in Italy, there tends to be a little distinction in terms of the patient journey. These organizations engage mostly people who have already been living with the condition for some years. In some countries, there is also a partial disconnect between the healthcare professionals who deliver the diagnosis and the Parkinson associations. Doctors do not always inform the person about receiving help from the organization, or the information given is simply not sufficient. It is important for Parkinson organizations to cultivate a relationship with doctors and with healthcare providers, as these are the first point of contact of the patient with the reality of Parkinson's. The Slovenian Association is a good example of successful connections with neurologists, built through a constant outreach work within the country. Having a set of clear, standardized information resources that can be circulated to healthcare professionals to be provided to people at the time of diagnosis, focusing especially on the idea of what to do straight after the diagnosis and on the importance of seeking help sooner than later, this was deemed generally useful by all interviewees. The association in Taiwan, for example, they work with the hospital to employ a special nurse coordinator that is funded by the hospital itself. She does outreach to newly diagnosed patients in the metropolitan Taipei area, and she provides training and support at other different hospitals outside of that area, seeing Parkinson's patients who are newly diagnosed and also others, in order to provide education and assistance to try and reach more suburban areas.
I work for Parkinson's UK. We operate in a high economy country with a health system free at the point of use for everyone. We still have challenges, however, and those are very similar to those described by Francesco. Our insight tells us that this happens for a variety of reasons. For some, there's a sense of stigma about having Parkinson's or denial of the impact of that diagnosis, and for others, a feeling of shame around seeking support from a charity. And we're only beginning to learn how to tackle the barriers that people from Black and minority ethnic communities face in accessing healthcare. We're funding a first for us as a charity, a project working with a hospital in London's East End, seeking to support people from the Bengali community. Many people from that community use the Sylheti dialect, which is in spoken, not written form. So discovering approaches that will work for this community is key and will bring us strong learnings. In preparing for this work, I've gathered insight from colleagues working across sub-Saharan Africa. The issues that emerge are similar to those already described and arguably exacerbated by happening in countries with other significant health issues. We think that the vast majority of people with Parkinson's in sub-Saharan Africa are never actually diagnosed. However, reaching the newly diagnosed is still vital. The main barriers are lack of knowledge within the population and also amongst healthcare professionals. Parkinson's is often felt to be caused by aging, potentially caused by evil spirits, or for a variety of other reasons. So people don't seek help from Western medicine, but may use traditional healers. One way we could help would be to see how we can provide access to appropriate information for people with Parkinson's and their carers in local languages and in a form that people who may be illiterate are able to access. There's obviously a major awareness raising issue amongst the general population to do, and a training issue amongst healthcare professionals. The biggest challenge of all, however, is trying to provide access to affordable and sustainable drug treatment. That's a challenge that we can't answer here today. To summarise, in countries grappling with other significant health issues, charities seeking to support those with Parkinson's face considerable challenges and themselves have extremely limited resources. Support from WPC to provide information in accessible formats and to support professionals to develop their knowledge would bring tangible benefits. And although access to the internet is a challenge, it does bring opportunity to share more readily with those charities and those they seek to support. We could use that to good effect in our work.
I represent the Parkinson's Foundation based in the United States. The Parkinson's Foundation is a global organization with a national and local presence in the U.S. that broadly reaches states and communities across the country and internationally. Similar to the diversity that Francesco described across EPDA members and European countries, the Parkinson's Foundation's reach and the makeup of the people we reach in states, communities, and neighborhoods across the country is no less diverse. From the person's side, the stigma issue is very real and still very present. This is one of the things we learned from the countries we surveyed and through the interviews we conducted. Particularly in specific cultural contexts, this seemed to be a major theme, a common theme that emerged. Stigma is perceived as a major issue that directly impacts people who are newly diagnosed and may prevent them from actually reaching out to national Parkinson's disease organizations for help. Even in a small country like the Faroe Islands, where reaching out to people should otherwise be easy, the organization mentioned people simply not wanting to engage or to discuss their situation after receiving a diagnosis. In a relatively large country like Italy, we heard that both the national and local associations report that stigma and shame are very present issues, especially in certain regions of the country. In Malaysia and Taiwan, for example, we heard these same themes around stigma, as well as issues related to denial and people not being ready to be identified with other people with Parkinson's. This also meant they were not open to support, resources, or services, and were not being open with their partners or family about their condition. We also learned that the significance and the impact of the various cultures is very real. For example, Malaysia is a multiracial country, and each race may have its own traditional treatment methods, and many people, no matter how educated they are, may still seek those out. Additionally, the fact that smaller size organizations, as a result of limited resources, including staff, time, and money, may simply be unable to develop resources or activities specifically targeting newly diagnosed people, which then adds to the challenge in reaching that population, especially for engaging those diagnosed at a much younger age. It is also clear how important thorough and comprehensive communication by a healthcare professional is at the time of diagnosis, and how important and valuable information and materials are that are developed for and take into account the specific needs of newly diagnosed people. These can both help to address this gap. We ask that you come to the June meeting with your ideas and with input, so together we can determine what would be most impactful for the newly diagnosed population and for our committee to focus on. Let us know what you need and what you may already have in place and can share to help reach and support the newly diagnosed.